I've been vlogging.
Okay. Mark, I have a question for you.
Let's.
How has your view of fillers and treatments changed since you started working in this industry?
Oh, a lot. Initially, you could say I was against it.
Well, you ain't anymore.
No.
Look at that sharpness.
No, but essentially, when it comes down, when I think about it, it's the lack of knowledge. Before, when I heard the word toxin, it was poison. Why do people put poison in their faces and other body parts? But when you educate yourself and get more knowledge and try some of this stuff, you actually see that it's not harmful. It's just a misleading word. It's exactly as with fillers as well. It's I mean, you have to educate yourself to see, and I encourage everybody to educate themselves before engaging into any kind of procedures, because lack of knowledge also will in the aftercare give you problems because you're not aware of what's happening to your body. So yeah, I would say I was really against it before, but thanks to educating myself, I have gained knowledge and really appreciate the gifts that we have and are fortunate to have here.
Okay, hi Oliver.
Hi.
What's the most common treatment you do here? Filler treatments?
Definitely lips.
And how many a day?
Anything from like 5 to maybe 10.
So if I do a filler treatment on my
Yeah.
lips, how long does it last? For results?
That varies. It depends on your metabolism, how much you like exercise. It can be, I've had a girl who dissolved everything in a month, and then there are people who have it like for months, up to a year. Completely, it's like at least a year.
Good to hear. Does it hurt? I'm a bit afraid for the pain.
No, I mean it's not comfortable, but that also varies. But beauty is pain.
But it's so worth it, right?
It's so worth it.
Yeah. If I want to go to a party tomorrow, can I do that? Or I want to look my best tomorrow.
I mean, then if you're open with doing lips, people will notice because you will be swollen. You can put makeup on it after 4 hours, but you will be swollen, and the swollen, I can never guarantee, like you can have swollen up to 2 weeks. The worst is the first few days, but up to 2 weeks you can have bruises, and that's very individual.
Okay. Can you change my shape of my lips and improve it, or?
Yeah, absolutely. We can change the shape to a certain degree. I mean, it depends on how your lips look from the beginning, but definitely that's what we work with, shape and not volume.
Good to know. Because I saw these lips on Instagram and I would love to have them. Can you fix that?
No. We could certainly try, but you have to have in mind that every lip is individual, and we always work from your lips and do the best from your lips. You can't have anybody else's lip, and if you try to have somebody else's lip, that's when you start to look fake. So we do the best from your lips,
and I want a natural result, of course.
And it's always natural. I mean, you can have small lips natural, and you can have bigger lips natural.
Yeah. And how much filler do you use?
That varies. I never think about it because you can't say like I buy 1 mil and I want 1 mil, because that's not how we work. It depends on your lips. Some 0.5 is enough, and on one she had like no lips, I put in 1.4 and you can barely see it. So it's very individual. It's not about how much you put in, it's how you put in. You could have two lips that are the same. You can put 1 mil in, it looks really nice, and you can put half in and it can look fake if you inject it wrong.
Good to know. So what's your favorite treatment?
lips.
Yeah, of course. Of course it is.
What you have to think about before, no alcohol before, like try not to drink a few days before, especially the night before, and if you eat omega-3, also try and maybe not eat for a few days, it thins out the blood, and also no Ipren, for example, before that also thins out the blood. Now with that all said, if you have done it, you can still do your lips, but keep in mind that they can bruise and swell more.
Good. Thank you. Okay, so what should I think about after my treatment?
Okay, I usually say like what you have to think about is don't touch your lips for 4 hours and don't put anything on your lips for 4 hours that you already have and it's open because it has bacteria on it. Unless you buy something new, otherwise wait 4 hours. No exercise for 24 hours.
And why is that?
Because you don't want the blood flowing and it gets the circulation into your lips and you can really swell.
Yeah.
And also no sauna for a week because the heat can also make it swell. And be careful in the sun the first few days of the week. And what is important to remember is sometimes people say, I have to go to work straight after, have a party, blah blah blah. Well, I mean, you have to have in mind it's not surgery, but it's a procedure, and the body reacts differently. Some people get bruises for a week or two, some get none. It's very individual, and it's not really about. I mean, of course, it's about who injects, but really, it's about your body and your anatomy, how it reacts. Some people bleed more, some less. And that also affects how much you swell and how much you bruise. But usually we say you get more swollen during that evening and always in the mornings. In the future you will like them in the morning when they're swollen, but in the beginning it can be a little bit much. In the first few days they can change shape a little bit in the morning. So you have to be patient. We always say be patient and wait at least 2 weeks.
Did it hurt?
No, it didn't.
No?
No.
I think that was the worst part.
Really?
Yeah. The other part,
Pro.
yeah, the other part is just a bit obekvämt. Vad heter det på engelska? Uncomfortable. Does it hurt?
No, nothing at all.
Good. Our beautiful colleague and skin therapist, Veronica. Are we finished?
We are finished.
Are you happy?
I'm so happy.
Massaging.
It didn't hurt at all.
Why do you do that, Oliver?
To prevent bruising.
But you can still get bruises, right?
Yeah.
Yes.
I always get bruises.
No bruising yet, though.
Yay. Kolla.
After picture.